A new employee, we took him out, laid him on the ground, activate ERP, get back to me, wake up, they're not waking up, detain, we do a head tilt, there's no breathing, check the pulse, there is a pulse, oh, and I see their arms tied up, and there's a blood streak, and there's a needle stick in here, so right away, breath, 1,000, 2,000, let's start breathing for him, breath going in, throw me your red sign bag. Want to breathe for them? Don't fight me. 1,000, 2,000. Breathe. If you can do what I'm doing, helper, breathe for them. You're not breathing at all. 3, 1,000, 4, 1,000. Breath. Think you can do what I'm doing? Yes. Once they start doing that, I'll put one of these in. All right. Now, helpers train. Oral airways in, oxygen's on. Okay, great looking kit. Exposed. What are the 6 things? Do a visual.
Sternum, ribs, abdomen, back,
Tummy should be soft.
lower.
See? Nothing. Now I've got an airway breathing check done. Now I'm going to do my circulatory check. The radial pulse absent. What should I do? Other side's absent. Okay. Skin is cyanotic, rapid body. Oh, I find a medical alert. So I find a needle stick that has some blood on it. So I need the naloxone. Rapid body. Okay, naloxone kit. Oh, there it is. Thanks. Now we're gonna get the needle, go to a muscular area. There you go. Once we've done that, then we're gonna get our scoop stretcher. Shoulder. If they don't wake up, then let us know. What do you got? Help me out.
Order the patient around.
Walk around. Thank you. Okay, get underneath them. Pat underneath your head. Push it in. All right. As soon as I get them on the board, reassess ABCs. Absent, present, skin. Okay. Right across. Okay, and now we're on our way in a couple minutes. I might do something like this just to get them going good. Most likely the person they've already spit the OPA out. Okay, we're gonna stop there. So you're having lots of difficulty breathing, automatically RTC. Come on down here, buddy boy. Sit up again, back up, sit up again. I'm gonna help you breathe. Put a mask on your face, count to 4, breathe. He says, F that, so how about this? Yeah. When I count to 4, I want you to inhale. 1, 2, 3, 4. Okay. You might actually accept that, right? So now, watch what happens here. So that's fine, you see that? Okay. If he accepts that, then you keep doing that. Okay. If he doesn't, what's the next best thing?
Action. Rebreather?
Non-rebreather.
Non-rebreather, 10-liter flow.
You wouldn't go to that before that BVM?
This is partial though.
No, you can just, I'm just saying you try twice with a pocket mask or once with a pocket mask, once with this.
Just trying to assist.
Or just, try to give them breathe. They don't want any of that. This is good. Breathe in, breathe in. He's gasping still, labored breathing, still needs some. Good. And there's nothing we can do. But usually with smoke inhalation, this is actually going to help them.
Yeah, I think we just go straight to that, because I choose.
You can, protocol says because they're gasping, that's called a dyspnea. Labor shallow, you talk about that? Dyspnea, labor, shallow distress breathing. And what's the intervention for labor shallow distress breathing? AR. AR, assisted vents or whatever you guys called it. What's the intervention for shallow distressed breathing, gasping for air? It's called dyspnea. What's the intervention? Dyspnea is AR or assisted breathing with a pocket mask. If that doesn't work, try oxygen. Now, recently somebody said to me, well, we were taught to use a BVM. I'm okay with that, but I'll tell you one thing, in a BVM, you need to get a good suction. You'll be able to tell us, look, right? Different than, you can tell the suction. So here's squeeze that, gently squeeze that for me. Squeeze gently. See that? Then you can see it one way. You can tell it's sealed. Now do it again. So you can tell you need a really good seal with this.
It's hard to train.
But with that, I do tell you, I did recognize one thing, and I'll be honest, first time I've done this. But when I'm gonna squeeze this, when I breathe out, I'm gonna squeeze it. See that? Resistance. Now I'm not gonna breathe out. Still, resistance. Watch this. Now I'm gonna breathe in. So how important is it that you time it when they inhale? Everything. That's all about. That's why it's so important. So Emily here, what happened, Emily? You got stung by a wasp? Did you fall or hit your head? And she's like, where's my happy? Where's your happy head? You don't know? Somebody go look in her locker. Come down here. I want you to sit up. You're not going to want to lay down because you can't breathe. You keep sitting up. Back over. There you go. So she's like, I don't want to lay down. Okay, give me your pocket mask. Go ahead, Skip. I know you're having a lot. Where's that EpiPen? Not here yet. Don't bring it yet. I know you're having difficulty breathing, Emma. I'm gonna try and help you breathe. Okay, when I say 4, I want you to go. 1, 2, 3, 4. Breathe. Hey, we gotta help you breathe because you're having difficulty. She's gasping. She's red. She's got rashes all over her face, and you can see it by the second her. She's going like it's not good. Breathe. What the? She's gonna put my hand. She's like, not helping, not helping. Okay. Well, EpiPen's not here yet. I'm gonna give you oxygen.
Do you want my
Do your best. Non-rebreather, 10-liter flow, hold it, and breathe in when you want to. Okay, so breathing. I know we're doing the best we can. Any pain anywhere else? Where the is that up? Oh, here's the EpiPen. EpiPen. Okay, relax, keep your heels up. Relax your legs, relax, there you go. Okay, we're gonna take this off. Take this away for a second, hold this in your hand. We made an incision in your pants. Right there, 1, 2, 3. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. I know, you know how this feels.
Doing.
Okay, good. Keep this in sharp container. Keep it for our records. And, all right, Kino, we're out of here. Keep doing it. Now you can, here. You build it up, you probably be able to breathe a little bit more and go down a little lower. Okay, is that okay? Soft, relax. It's only gonna last for 15 minutes or so, right? And it's gonna get back, so we can find her. And we're en route, left side. Start our secondary. Okay, the only moaning a little bit. This is a known diabetic, right? Okay, wake up. Head tilt, chin lift right away. So if the airway is clear, I would try an airway. If they didn't accept it, what would I do?
All 3/4 pump.
3/4 pump. But right now, I noticed that they're making a wet snoring sound. So right off the bat, get a blanket here. Right next to her, a couple inches away. I'm gonna go elbow, knee. Yeah, let me bend your knee, man. Watch this. So look, elbow, knee, elbow down, knee down, clamp. Elbow down, knee down. Tilt the head. Sorry, buddy.
Poke him in the eye.
Okay, so notice I'm tilting the head back. So elbow down. Look, a lot of you are gonna miss this, and I'm gonna get a little bit upset.
Oh, we're not, Tommy. We're getting it. All of us are getting it.
I'm not. And I'm a pretty nice guy until I'm not. And then, so elbow down. So this, I don't want this elbow like this or over here. I want it down here, and eventually you can do this sort of thing. There's a method to my madness. Elbow down, knee down, tilt the head. So 1 elbow, 2 knee, 3 tilt, 4 drain, 5 listen. Nasal. We'll say there's a nasal here. 4 to 5 liter flow only. A's good. B, C. Okay, when I Pilco clam, he's got nasal. Oh, I see a medical or saying they're diabetic. Give me some sugar. If they're high in sugar, they won't get any worse. If they're low in sugar, they'll get better right away. Now we're gonna work on this. So maybe I like to do a little blanket here.
Oh,
Boom, boom. Look right across here. Shoulder. Okay. Help me out there, Dave. Flavor Dave.
round pieces.
Dave Osborne. Super Dave. Yeah. David Carradine. Statue of David.
Dave's not here. Forgot about that one.
Dave doesn't live here anymore. Okay, I'm gonna pull this. You push it in. Push it in. Push it. There you go. Now let's get a blanket right here for him. Any blanket will do. Not that one. Just kidding.
Any one of these.
So now, grab and pull towards you. Okay. Sorry there. It wasn't me, it was Dave. Airways clear. Elbows down, knees down, airways clear. Breathing, pulse, skin. Okay. There's no reassessment, all right? As soon as I get them on the board. Give me a second, buddy.
He's gonna need physio after all that head yanking out of him.
You think?
You're next.
Yeah.
And then of course, remember I did it, I asked for some sugar, and then I would get the glucogel, put it inside the mouth and rub it in. You see that little sleeve of glucogel somewhere here? The pink one? You see it? You must have seen it once or twice right here.
I got some in my bag.
There you go. In your bag or in this bag?
No, inside my bag.
Are you diabetic?
No, I thought I was. I was trying to figure out what I was. They said the doctor still not diabetic as well.
Okay, well, then we get people to check with you. I mean, but not in Canada. You have to go somewhere else. Ooh. There you go, people. Hollywood, here I come.
Looks like an even slobber.
Please don't. Okay, so, ready? So, action. So this person here was having a headache, you know, not making a lot of sense, mumbling. All of a sudden, they started to pass out. We grabbed them, laid them down gently on the floor. One patient, no hazards. Activate the ERP. Okay. Hey, Jim, it's Tom here, man. You okay? Can you hear me, buddy? Can you hear me? He's only moaning a little bit. You know, when I talk to him, his eyes may flicker open and shut, indicating he's not fully alert and oriented. So I treat them as if they're unresponsive. So when I do a head tilt chin lift, 1,000, 2, 1,000, 3, he's got good air exchange, the airway's clear, but it's not managed. And so just say, when I go to put, he gags on it, so as soon as he gags on it, you're good. So So I don't want to spend too long doing this, but notice what I do here. I'm really big on this because I don't want to, I know what it feels like to be on a hard piece of plastic for hours on end. It doesn't feel good. Notice where they are. Come here too far away. A couple inches from the body, 3 or 4 inches from the body, right next to the body, by the knee. This. Relax. Put them over. Now watch what I do here. Elbow down. Elbow down, brother. Knee down. It's not gonna hurt you, brother. Now take a look. Come over here. So right now, my friend is still gonna choke unless I tilt the head back gently. All right, so now I know for sure he'll do. If his head is up like this, he's still gonna choke on it. If his head is down to his chest, he's got it down, facing downwards. And that's why it's important, Shay. It doesn't matter what side he's paralyzed on, long as they're facing downwards and the head is tilted back.
Fairway again.
Okay, good. Now I'm gonna get a nasal cannula here.
The reason he's going with nasal.
Where's all the nasals I had in here?
Nasal because he could drool. So don't want to put it on
Well, you can't put
any
Nasal
mask on.
Stop talking. Let me finish it down. We'll then talk.
sorry.
Nasal cannula, 4 or 5 liters. A's good. B. B. C. Any pain? So he's got a left droop to the face and the right side of the body. He tells us a little bit weak and hanging. Okay, nothing else. Updating RTC. My patient's having a stroke. Okay. Yes. This is how I do it. Take a look. So I go this first, second, third opening, middle, third opening at the top of the shoulder. Good. Undo this. Go past the feet. Click it. There you go. Past the feet. Click it. So undo this one. Help me undo that one. Undo it. Yes, sir. Go down here to number 3. I'll do it for you here. Thanks, brother. We're gonna need you to stick around there, Bane. So, I'll do this. Bane, I need you to grab that for me. Walk around. Do the old walk around. Don't
Walk around.
Good. So make sure your buckles are being great within the body. We're gonna go close underneath his feet. We're gonna gently click. So watch what happens here. So, stick your here. I need one more blanket quick. I got it. You don't have to relax, my friend. No, we're not gonna hurt you that much today. Push it in, baby. Come on, through the foot, click those. Good. Now watch how I do this. Okay, pull them towards you, Bane. Just a little pull towards you right here. 1, 2, 3. Good. Now watch me here. Ready? Push it in right in. Go, go, go. Push it in.
And then clickety click.
Smart man. Smart man. Tilt the head back. Drain it. Airways clear. Breathing. Pulse. Skin. Okay, now we're going to go this way. And that's what we're going to do. And we're going to show my friend.
If I ever get a stroke, don't do this.
Well, you're not comfortable because you're comatose, buddy, or you're out of it anyways.
Oh,
Besides, I mean, Kate, can I have your Chevy, please?
he
He said you heard? He said, yeah.
I heard him.
I haven't been in this position
go
since the
contract.
6 cops tried to get me.
Ah, you're on video, don't implicate.
All right.
Is that
So when a patient comes in here, they're clutching their chest, they're really sweaty. Hey, what happened?
had so much pain in my chest.
Did you fall or hit your head?
No, I did not.
Okay, how long ago did this pain start? She says about an hour ago. What were you doing? I was lifting some heavy material. Okay, why don't you come in here, very close, so I can see. Come right down right there. Is that okay?
Comfy bed. Oh, yeah.
Okay. Oxygen. Then we're going to check the breathing for effectiveness. 10-liter float on your breather. How's your breathing? Okay, it is, but I noticed that it's a little shallow but effective. Pulse. Okay. Skin is peeled but clammy. Do you have any pain anywhere else? She said just across my chest, and she, points to her arm and back. Okay. Do you have, and so nothing else, like you didn't actually fall down, no other physical pain anywhere else? She says no. I may put a tank here, or I could just hang up on that for me, please. There you go. Are you on any medications at all? She says, nothing we should know about? No? Okay. I'm going to ask some questions. Where does your pain physically start? There's points in her chest, neck. Okay. And mainly it starts in the chest. Okay. And what was making it worse? She says, when I was doing that lifting, it started getting bad. Okay. And now, what would you describe it feels like? She's like, it's very heavy and tight, like something's crushing my chest. Okay, and is it spreading her? She goes, cross. I told you, my chest and neck and arm and my back. Okay, holy smokes, calm down. And then, are you feeling any better at all? No. 0. And if it was scale of 1 to 10, 1's great, 10's the worst pain. She goes, it's a 9 or a 10. And that's a lot for me. And how long you had it for? She goes, about 55 minutes to an hour. I'll put an hour. Okay. And so, are you by any chance allergic to aspirin? Have you ever had aspirin? She says, yes. We're going to give you, you're not allergic. We're going to give you 280 milligram chewable tablets of aspirin. Buckle you up here, and so
Just one buckle?
She's not a spinal.
all right, you gonna be okay? All right, and we're gonna be en route. We're going to start our secondary survey here. All right, so otherwise, you know what day it is? What day is it today? Monday all day. Okay. All right. Alert and oriented. We'll stop you there.